We've chosen to watch ankle sprains, the most common work-related injury we see in and about the ankle. Defining an ankle sprain is defining the anatomy in and around the ankle. Let's take a look at our ankle anatomy and define what ligaments are torn. Note first the lateral ligamentous complex. There are three structures there. The anterior talofibular ligament, we define the lateral malleolus, and then define the anterior talofibular ligament. There are two other structures in and about the lateral aspect of the ankle. If there's an anterior talofibular ligament, there sure is a posterior talofibular ligament, and there's one in between called the calcaneofibular ligament. In all ankle sprains, these three ligamentous structures tear first: anterior, calcaneofibular ligament, and posterior talofibular ligament. Now let's take more force so the structures laterally aren't just torn, but the forces are delivered posteriorly around the medial side of the ankle. We define the bony anatomy the same way, except this time we look at the medial malleolus, outlined here in red, and the deltoid ligament, a big, thick, tough bilaminar structure, comes off the distal tip of the medial malleolus and inserts into the talus. You can define it with a fingertip, localized palpation and pressure there. You have a grade 2 lateral and medial ankle sprain. So now let's deliver even more force. The forces come around the medial aspect and extend across the anterior joint line where the tibia and the talus communicate. This anterior joint capsule is well defined with the foot dorsiflexed to 90 degrees. There, this red line delineates the anterior capsule. Localized tenderness to fingertip palpation over the anterior capsule now defines a third degree, a potentially unstable ligamentous injury of the ankle. One more provocative test should be done. This is called the drawer test. Watch here how this is performed. Note the knee has to relax the gastroc soleus unit, 90 degrees bend at the knee. The ankle has to be 90 degrees. By stabilizing the calcaneus with one finger, grabbing the mid or forefoot with the rest of your hand, you can stabilize the tibia. Now you just try to sublux or dislocate the talus out of the tibial plafond. Watch what happens here as we close up look at this ankle. It actually has a positive anterior drawer test. This usually is accompanied by patient discomfort exhibited here. Only by your documentation of the pertinent positives and negatives in your physical examination will you help Texas Mutual arrive at the right diagnosis. Thank you for watching Workplace Diagnosis.